Since the NHS was founded 60 years ago, most people have worked together in a very cooperative manner. It's one of the great things about the service. We don't have those sort of jagged edges some other World Health systems have. It's inevitable over time that relationships have built up which in some ways are cosy, and those can be misinterpreted as being collusive. So Jack's always dealt with Fred and Mary's always dealt with Sally, and we've had comfortable arrangements which sometimes, when the spotlight of transparency of contracting is shined upon them, don't actually stand scrutiny. What we're trying to say to the service is, look, that's fine, that worked well 10 years ago, 20 years ago, 30 years ago, but the government has said we have to conduct our affairs in a new way. We have to procure, we have to do things on an arm's length basis. So we're saying to people, just do it properly. Most of you are doing it properly, but get your processes right so that if anybody does ever question it, you are seen to have done this properly. That's what we want. And that's really absolute, the word I'd stress time and time again is transparency. If you always work on the basis when you're doing anything in contracting, procuring, merging, always work on the basis that the public will peer into it at some point. Where competition is beneficial to the NHS is in bringing innovation, finding new ways of doing things. Often established providers, incumbent providers, are just getting on with what they have to do the whole time. And of course, healthcare is very pressing. You know, there's issues all the time you have to deal with. Looking outside to the independent sector, looking to people from bringing solutions from other countries, sometimes is one of the good ways of bringing in innovation. And also what I think we're seeing is a great deal more competition from within the NHS. I think many people have thought that what this whole process is about privatisation. It's not about that at all. It's about actually creating a market which is largely internal. And if you look at the work we're doing, most of the cases we are being asked to review are matters of competition between NHS providers. Looking ahead in terms of the economy and the squeeze we're going to face after 2011, you have to ask yourself, how will the service react? Okay, how will it deal with this? And clearly, we're going to have to see how collaboration provides some of the answers, and in other areas, how competition provides some of them. Now, most people would agree that the best healthcare systems are those where the interests of the commissioners, the people paying for the service, and the providers are aligned. And what is going to be really interesting in this country is the development of the care pathways. So what we're seeing is the sort of work going on at Trafford in the northwest. Who should own the care pathway? Because most people would agree that a large number of people in acute hospitals should not be there. So how we reconfigure the service, how do we stop those who don't need to go in, how do we get them into another setting, and for those who are in there too long, how do we get them out and into another more appropriate setting? And there's a contradiction in this, because the way acute providers are incentivized at the moment under the payment by results system, clearly they're incentivized to treat as many people as they can. So the time when worldwide people are saying we need to decrease the number of people in acute hospitals, our payment system incentivizes people to be admitted. Now, to work through that, we're going to need a really collaborative approach. Competition isn't going to solve that. That's a structural issue. Okay? On the other hand, in the provision of services out there, I have some experience of pathology, for instance, you could see that competition could actually drive higher quality and lower prices. So I think there's a role for both. And I don't think you can say we can actually drive reform in the NHS by let the market rip. I mean, I think it's about as daft an idea as there's ever been, okay? We need collaboration and we need cooperation and we need people to work out how this goes. In order for it to be transparent, we need good information. We need good benchmarking data so that when you make a decision to actually deliver a service in this way, you need to be able to say, I've benchmarked it and I know I'm buying that at this quality, at this price, and it's a defensible decision.